Good afternoon, everyone. Today is Thursday, September 18th, 2025. I'm Dr. Yamona Smalls, Director of Professional Development for the Maryland Department of Health's Developmental Disabilities Administration. We welcome you to today's Waiver Advisory Council meeting. If you would like to use closed captioning so that you can read what is being said, click this button. Sometimes the transcription is not exact, but it is pretty close. All attendees are currently in listen-only mode, and your mics and cameras are turned off. Today's presentation is available in the handout section. Click here where you see the paperclip to download the presentation. If you have a question and you'd like us to read and answer, click here where you see the question mark to mark and ask your question. If you would like to ask your question aloud during our comment section, please click this button to raise your hand. We will invite you to unmute during our public section of today's presentation. And just a reminder, if you are not speaking, we ask that you remain muted. Thank you. And now, before we begin our meeting, we also want to ensure civility for all meetings. The free expression of diverse viewpoints, the fundamental value of our group. This freedom carries the responsibility to engage respectfully, which means treating one another with dignity and respect and good faith. Uncivil behavior, disruptive conduct, abusive language, threats, or harassment will not be tolerated and may lead to being excused from the meeting. Thank you for helping to keep this productive and comfortable for everyone. And now I'd like to introduce DDA's Director of Federal Programs and Co-Chair Rhonda Workman to begin today's meeting. Good afternoon, Rhonda.
Good afternoon and welcome everybody. We're excited for you to be able to join us today in person and online. As Dr. Smalls shared, I'm Rhonda Workman, Director of Federal Programs, one of the co-chairs. And Charlotte, our other co-chair, is with us virtually. So Charlotte, would you like to introduce yourself and go over the council purpose?
Yes, hello everyone. My name is Charlotte Whitaker. I am a participant of the self-directed services. The purpose of the council is to provide input on DDA operated Medicaid waiver program system design, service delivery and access to services, as well as federal waiver assurances, ensuring access to Medicaid services, also known as the Access Rule, and quality enhancement efforts and improvement strategies.
Thank you, Charlotte. Can you go to the next slide, please? So as we do with each meeting, we'd like to open up with our ground rules so we can just all be on the same page. In our meetings, we always want to assume positive intent. We want to speak one at a time. We want to use plain language to make sure that everybody's understanding. We want to share information openly, listen to different points of view. We want to stay flexible and open-minded, participate actively, engage respectfully and politely, and minimize our distractions. We got the next slide, please. Deputy Secretary, would you like to share any welcomings?
Absolutely. Good afternoon, everyone. Thank you so much for joining us in person, and for those of you who have joined online. Our Waiver Advisory Council has a lot of really good information and updates that we'll be sharing this afternoon, so we are very much looking forward to the conversation. If my team could please mute all mics except Charlotte's, just so that we can get through the presentations until we open up mics. Please do so. Thank you so much.
Yeah, so just a reminder for those online, Karen, just so you know, We're going to keep your mic muted, so I know it appears someone keeps unmuting it, so if you could just hold for now, and when it's time, we will call on you. You can raise your hand, but we're going to keep your mic muted at this point. So thank you so much for joining us. We'll go to the next slide, please. So here's our agenda today. Charlotte's going to walk us through and ask for approval of the August meeting minutes. We're going to go through a variety of DDA updates. Then we're going to have Charlotte share some information related to people with lived experiences groups in terms of their updates. We'll also see if there's any updates or information from the waiver recommendation group, and then we'll open it up for public comment. So I'm going to turn it over to Charlotte now to the next slide.
Thank you, Rhonda. So we are trying to get the August meeting minutes approved, and through that, would anyone like to amend or add to the August meeting minutes? If there's no one that would like to amend, would someone like to approve or second?
I'll make it to accept the minutes.
Second.
Second.
Okay, great.
Thank you so much. Go to the next slide, please. So we're going to talk about a variety of DDA updates, and we're going to pause after each update and see if the council has any discussion related to that. So we're really looking forward to having some dialogue. Go to the next slide, please. Our first update is related to the DDA operated Medicaid waiver program design. Go to the next slide, please. So as you know, we have submitted an amendment to the Center for Medicare and Medicaid Services. We have been in discussions with them related to the amendment. The department has specifically been responding to questions that we've received. And the Center for Medicare and Medicaid Services has asked us to add some additional information to the waiver amendment. And so I'm going to share some information about some of the themes that we have seen. They have asked us to note that for the amendment that all services that are available for the family supports and community supports waiver are in the community pathways waiver. They just want to make sure that that's documented. And so as we know, it's the same services. All the services are in the community pathways waiver, so there's no difference. They have also advised us that internet services cannot continue under individual and family directed goods and services. This is because they've advised it's against federal rules. They have shared with us that we could cover initial startup, such as purchasing I'll get the word, modems, and other startup services could be covered. Next slide, please. In addition, in terms of our remote support services, and so these are some great services that are provided off-site with remote access for individuals and remote staffing. They wanted us to add some additional information. Specifically, they wanted to make sure that each individual was aware that they have the opportunity to turn off the remote monitoring, right? We want to make sure we're respecting their rights. And so we have added information in there, but also have noted that there may be situations where a person has a behavior support plan or nursing care plan, and those things need to be considered. But we want to make sure for individuals that are using remote support services that they are aware of that right, in addition to anybody else who lives in the home who has already given consent to those. In terms of our virtual support delivery model, they asked us to provide some additional information. And specifically what they want to do is, again, they want to make sure that individuals are being supported, and especially the rights. So they wanted us to provide a little bit more information related to ensuring that the individual's privacy is protected when virtual supports are being provided. And virtual supports is an online support. It's a service delivery model where providers are delivering their services online and instead of in person. And so they've asked us to add information related to privacy, ensuring that hands-on assistance is needed for the person during the virtual supports and that it's available. To look to see to make sure that supports are available if they need it with the use of the technology. And also ensuring that the participants' health and safety are being met. So we have noted that our providers who are providing virtual supports in their program service plan, currently they have to have policies related to how they're going to provide virtual supports. And so what we are asking is that they would ensure that they are addressing those areas, privacy, supports with technology, hands-on assistance, in addition to assurances for the health and safety, and that would be noted in their program service plan and their policies. We know that some of our providers that currently provide virtual supports as a service delivery model already have this information, but we are noting in the waiver that if those that do not, that they would have until July 1st of 2026 to make sure that that information is updated. Next slide, please. CMS also asked us to provide a little bit more information related to safeguards when a non-legal representative is providing support or assistance and making sure they're functioning in what they call the best interest of the person. So what we have related to this is we know our coordinators of community services do monitoring and follow-up support. So they're checking with individuals on a quarterly basis and more frequently as needed. And when they do that, they do a variety of things. They're checking on services, satisfaction, are they receiving them, goals, those type of things. So we also added that when they're meeting with individuals, we're going to be working with our coordinators of community services so that during that monitoring and follow-up, we want to expand the questions that they're going to be asking. And that's some of the things that we have been talking about this week already. And that would include checking in to ask the person how they feel about their privacy when they're receiving services. And that would be for all services, health and safety needs, making sure that they're happy and satisfied with those services and supports, and include asking about the use of representatives for directing their services, and including the non-legal representatives. So really, we need to continue to ask people if the supports and services and the individuals that are providing either paid services or even maybe supporting in decision-making, that they're happy with them and that that's meeting their needs. So we added just a little bit more information related to that. And we've also clarified that currently our case managers, our coordinators of community services, in addition to our financial management counseling service providers, will alert us and submit incident reports if they suspect or believe there's an allegation of maybe fraud, abuse, neglect, etc., that would be impinging someone's rights. So that's another thing that we added that is an existing process. With that, as incident reports are submitted to the DDA regional offices review them, and also the Office of Health Care Quality would be reviewing incidents that are our highest concern incidents as per our policy of reportable incident investigation. So we just added that additional clarifying information of processes that we currently have that's noted in the waiver amendment.
Can I ask a question on this?
Yeah, I was just going to pause and say,
Okay.
go ahead.
Could
You, I'm sorry, as we talk, because people may not be able to know who's speaking, can you just identify yourself? So,
Hi, this is Karen Lee from C. So I'm wondering what the training for CCS is on, this is a different interview skill than they're used to. I know it's the incident reporting, and so on, our staff have to be trained once a year on that. Is there any additional training that will be added to the CCS curriculum about this? Because it could be a lot of conflict.
Yeah, that's a really good question. I'm going to ask maybe one of our coordinators of community services representative if they want to share. We have reached out already to the communities of practice of coordination of community services, so we're working with them to talk about this. We did have some questions about how to enhance the monitoring form, so we'll be looking at that. But we can absolutely look at that and see what additional support is needed and look at that. So if you have any recommendations, we are absolutely open to looking at that in partnership with our coordinators of community services.
I don't have any recommendations, was just to
Yeah.
clarify if there's going to be additional training on this.
Yep.
And then these are things that they were required that you changed, and you changed them and they have accepted them, or you're waiting pending.
Yes, so we have changed, right, so they sent us questions. We provided information. The information that we provided, then they had provided us guidance and directive to add them to the waiver. So they have been added to the amendment. Good questions. Other
And just to
questions?
be clear, the amendment still is not approved. It's under review.
Okay, thank you.
So this is Teresa Tyus-Howard with the Coordinating Center at CCS Agency. So it's common practice that we ask these questions already, just as a matter of course of meeting with clients. I'm just kind of curious, Karen, about what you perceive as conflict.
Cause, right? You're meaning some of these questions could cause feelings that could create conflict. That was your,
Yeah.
not that there would be a conflict of interest, but
Right.
that depending on.
If somebody is in the room that is,
Got it.
right, right, so being able to, my experience in all of these years working with people who are in coordinated community service, sometimes families are unwilling to leave the room, and so it would be difficult to ask those kinds, and so there could be conflict that the CCS has to deal with.
Got it.
When asking these questions.
Absolutely. I understand. Yeah. Thank you.
If I could ask a question.
Sure.
Emily Rowe is here, and I'm here as her support person.
Okay.
And the question it's still the same question regarding the CCS, and also going back to live experiences and going back to what you were stating. Well, just two questions. How will the safety or the concern regarding the actual organization that provides the services, how will they be monitored to make sure that, I think it's a couple of instances, if a person is asking the questions, what if the person who's receiving the questions, one, may not understand? That's the other part. And then two, maybe the person that's even in front of them that's rendering the service from the CCS makes them feel unsafe. So how is that going to be monitored? And how would that, where would it be reported to? What would be the process for that?
Sure. So I'm going to say a couple things, and then I'm going to ask Teresa if she wants to know. Caitlin also raised her hand, who represent our coordination and community services. So absolutely anyone who feels not safe, threatened, or concerned, regardless of who they're interacting with, should immediately report. They can contact the DDA directly, and an investigation can occur related to that. So we absolutely, if anybody feels any of those type of situations, we would want to support them. Teresa, I'm going to ask you if you want to add anything to that.
I'll let Caitlin go.
Okay, Caitlin, can you? Caitlin, she should be able to.
Hi.
Caitlin.
Can you hear me?
Yes.
Okay. I was just going to add on to that this could be a conflicting position for the CCS, particularly with individuals who are nonverbal or have limited communication. Because as I'm not sure who was speaking before me, but as they said, sometimes the person receiving the questions is also, the representative is the one providing us the answers. So it just could be difficult to navigate that.
So this is Teresa again with Coordinating Center. I agree. I mean, there's the dynamics of the family, and being able to manage those dynamics is definitely within the CCS's role, and there's a lot of training around that. I think there always could be additional training, to Karen's point, around how to, when you have a family member that disagrees and you have a client that may be not able to quite verbalize or whatever the situation might be. I think there could definitely benefit from additional training on that, for sure.
Other questions? Just looking to see if we have council member questions online. Stephanie, we're working on your link for you.
Rhonda, Stephanie has raised her hand.
Okay, Stephanie. Stephanie, if you can unmute.
She said she cannot unmute.
Okay, hang on 1 second.
Great, thank you. Just thinking about the safeguards in this, and I've worked as both the CCS and as a court broker now, and seen both situations where an individual maybe can't so whoever's representing them in both worlds, provider world and in self-direction, you know, for whatever reason, not being able to maybe truly give their answer, or their answer is encouraged by those around them. So I think it's a safeguard that has to happen in all models, and I think we just have to be careful that we don't just assume that if they're in one model or another that that they have full ability to give the answer that they want, or that they're fully represented. I just think we have to be really careful in both models.
Great, thank you, Stephanie. Any other questions before we go to the next topic? Can we go to the next slide, please? So we're going to now turn to our updates on service delivery and access to services. To the next slide, please. And we are going to, again, talk about the federal waiver requirements. Next slide. So at our last meeting, we shared that there are a variety of federal assurances that home and community-based programs must assure. These are the list of those on this slide, the next slide that I'll review. Last month, we reviewed the administrative authority, where we had our Medicaid partner talk a little bit about that. Today, Amma Awashigankor is here today to talk a little bit about the level care performance measures. So each meeting, we want to make sure that we kind of touch base on these and share a little bit more about them. And then Nicole's going to share some updates related to our qualified providers performance measures that we talked about last month. And then Janet's here to share some updates about some quality improvement strategies. So just as a reminder, there are federal assurances that all home and community-based programs must meet. And so some of the assurances are specific to administrative authority. And this is where the Medicaid office is responsible for the operation of the program. And there are specific measures that are within it that Elisa talked to us about last time. Our level of care assurance relates to making sure that people that are enrolled in the program meet the level of care that's consistent with an institution. For our programs, our institutional level of care is referred to as intermediate care facilities for individuals with intellectual and developmental disabilities. And for us in the state of Maryland, that would be our Holly Center and Potomac Center. The next assurance relates to qualified providers. And the state must make sure that we've got a system in place that we're assuring all waiver services are provided by qualified providers, which I think we would all agree is so important. Next slide, please. Additional assurances relate to service plans. And so this is our person-centered plan. And so we have to have a process and oversee it in terms of the review and approval of those plans. There's also assurances related to health and welfare and making sure we have a system in place to include an instant reporting process. And then the last assurance relates to financial accountability. And that's a system to be in place to ensure financial accountability in the waiver program. You may recall at our last meeting, we had some information from the Hilltop Institute related to cost neutrality. So let's go to the next slide, and I'm going to turn it over to Amma to share some information about the level of care.
Thank you, Rhonda. Good afternoon, everybody. My name is Anna, and I'm the Division Chief of Eligibility. The Federal Centers of Medicare and Medicaid Services have rules about making sure that people meet the right level of care. The DDA must show that it consistently uses the right tools and processes to determine an applicant or participant's level of care. These decisions must meet the same standards used in the hospital, nursing homes, or facilities for people with intellectual or developmental disabilities. So the state tracks two main things to make sure that this happens. The first one is related to initial level of care determinations. Every new applicant must have a full assessment of their needs according to the state rules. This includes reviewing all assessments and supporting documents related to that. The second one is related to level of care determinations made before services start. Before someone can start receiving waiver services, the DDA must confirm they meet the required clinical and functional criteria. This ensures services are provided only to those who need them, who meet those criteria. Next slide, please.
Good afternoon, everyone. My name is Nicole Kretfelder. I'm DDA's Division Chief of Quality Enhancement. As we shared in last month's meeting, DDA is required to complete and submit our quarterly and a final fiscal year annual quality report to the Office of Long-Term Supports and Services. DDA is to maintain an 86% compliance on all performance measures. Otherwise, DDA is required to develop remediation strategies on each performance measure that does not meet compliance standards. For fiscal year 2025, the DDA met compliance within all of our performance measures except for qualified providers. The 4 performance measures on the slide have not met compliance within the community supports and community pathways waiver for all of fiscal year 2025. As a reminder, DDA licensed and certified providers are expected to follow COMAR 102202B, which states a provider's application is required to be submitted 60 days prior before expiration of its existing license. Next slide, please. On this slide, there are 2 graphs. The graph on your left explains the percentage for each quarter over fiscal year 2025 related to licensed providers submitting their renewal applications. The red dotted line is DDA's baseline at 86%. The green line is for family supports waiver, which is at 100% compliance. Community supports is in orange with an annual percentage of 65.2% for the fiscal year, and blue is community pathways with an annual percentage of 72.3% for the fiscal year. You can also note how in Q4 there was a slight improvement for community pathways, and this is due to the 3-year renewal requirement. The graph on the right shows certified providers' compliance in submitting their renewal applications. Again, the red dotted is our 86% compliance threshold. Green is the family supports, which is 100% for fiscal year 2025. Orange is community supports with an annual percentage of 47.4% for the fiscal year. And blue, community pathways with an annual percentage of 72.3% for the fiscal year. Again, as you may see, there was an increase in compliance in Q3, which is when DDA transitioned to the 3-year renewal for licensed and certified providers. DDA will continue to monitor compliance within each quarter moving forward, and we are hopeful that there will be a continued increase in compliance as we have implemented strategies that will be discussed further. Next slide.
So before we go to the next slide, let's take a moment, and I just want to go back to Amma's presentation because I was a little bit busy. So Amma shared some information about the level of care, so that's one of our assurances. I wanted to pause and see if we had any questions or discussion about level of care.
I'm asking you, Karen Lee from SEEK, if there is an intention to make changes with the new opportunity for changing the level of care in the waiver.
That's something that definitely could be explored. We are just sharing the assurances is our intent for sharing the different waiver assurances and providing information about the performance measures. If that's something that the council is interested, the recommendation, the waiver recommendation worker.
But to answer your question at this time, no. We have not taken that new opportunity into consideration.
Other questions about level care? And before we go forward, so Nicole just shared some updates related to qualified providers. So let's pause there and see if we have any questions or discussions related to qualified providers.
I have a question.
Can you, if Emily would like to share the question, that would be great.
Okay.
We can come to your questions at the end.
Okay.
Public comment.
Okay, because I'm also acting as proxy, but okay.
You're proxying for Emily, who's here?
Well, no, it's fine.
Okay,
It's fine.
okay. Emily, did you have a question you wanted to share?
I don't have any questions.
Okay, great. Anyone else?
So, yes, Teresa with Coordinating Center. So with the falling below the threshold, what does that indicate then for DDA? So is it like an action plan to increase the number of licensed providers? Is that how that works?
Right, so what that means is we are not meeting the minimum threshold, which is an 86% compliance. We report this information to our Medicaid partners, who then reports this to the Center for Medicare and Medicaid Services. And so then we would be required to have a quality improvement strategy. And that's some information that we'll be sharing with you next. But yeah, so anytime that you're non-compliant, and particularly with Nicole sharing for our programs, it's more than 1 quarter, like there's a pattern. We definitely need to address that.
And is there a common theme of reasons why?
Nicole?
Yeah, so the common theme is that providers are not submitting the application prior to that 60 days of their license expiring. And it can range from like literally 1 day late to 90 days late. So,
okay.
Yep.
Other questions? Let me go to the next slide. Sam's going to share a little bit of information about what our strategy is to improve our compliance.
Hi, I'm Janet Furman. I am the Deputy Director of Programs for DDA. And in response to what Nicole shared, the DDA team has worked to draft a quality improvement strategy to try to improve our compliance with this particular performance measure. So starting at 120 calendar days before the provider's DDA license or certification expires, the regional office staff will be emailing the providers with renewal instructions and a self-assessment tool that is in development. The providers must submit the self-assessment tool at least 90 days before the expiration of their DDA license or certification. And the DDA regional offices will be available to provide technical assistance with this process. Next slide. 75 to 90 calendar days before the expiration of the license, if the provider has not yet completed the self-assessment tool or is in need of help, the regional office will meet with the provider to review that. The review will cover the provider's current status, updates, challenges, and concerns with the renewal application. Staff will also review policies and procedures, program service plans, quality assurance plans, community settings rule, compliance, incident reporting, and provider performance. And part of what we're looking for in the self-assessment is providers to actually do a self-assessment, not check yes or no, but to really assess and say, we looked at our program service plan, our agency and board determined to make a change in this particular area of our program service plan, so we'll be updating our program service plan. Or we reviewed our incident reporting and we had some concerns about the time it was taking to get stuff submitted or the quality of the reporting, and this is the action that our agency is proposing to take. Next slide, please. And then 60 calendar days before the expiration, the provider should have submitted their license renewal application or their certification renewal application. If that hasn't happened, DDA's regional offices will meet not only with the board, the provider's executive director, but also the chief executive officer, if that's how they're set up, and the board president. And this meeting will include the provider's proposed work plan, which they will be developing with milestones and due dates as to how they're going to come into compliance. Meetings may also be scheduled to discuss any other provider-specific concerns that didn't seem to be addressed in the self-assessment tool. Any questions?
As Janet said, we're really trying to support as best we can that 60-day. And as Nicole has shared with us, some providers are a day or two late, or it could be a few months late. And so we want to do everything we can to support that compliance in terms of getting that license or certification renewal application in as per the regulations. And then a great opportunity for providers to really take a look, assess how things are going, make adjustments, but also technical assistance being available from the DDA provider service staff, QE, others, so that we can support. Because we want to continue to support and enhance our partners, our DDA providers, to continue to provide the quality services and supports. So questions, discussions about the information Janet shared related to this strategy to help us become more in compliance with qualified providers.
Karen Lee from SEEK, is there a turnaround time or time frame in which DDA will review and give feedback or approve the license?
I don't have that answer for you right this minute. I'm still learning too, but we will be putting all of that into our operating procedures for that.
Thank you.
Other questions from the council?
I just want to, it's not a question from the council, but just to highlight that this qualified provider requirement involves DDA and Medicaid. So we are working very closely with the Medicaid administration, their ePrep team, as well as their Medicaid provider services team. We have heard that providers sometimes get caught up in the ePrep process, and that adds to timeframes and so forth. So we're measuring all of those things. We're looking to kind of deep dive into those things and working very closely with our Medicaid partners because that can impact timelines as well.
Any additional questions or comments?
Just a little feedback on the graph. Again, I'm a QI background person.
Sure, absolutely.
Maybe at the end, I mean, how many providers is this compared to, numerator and denominator? That'd be helpful. Okay, thanks.
Okay. We're now going to.
Can I make a comment?
Sounds like Matt.
Okay,
Yeah, sorry, this is Matt. Can I make a comment?
Yes, please, Matt.
We routinely submit our application, early on time, like 90 days out or something, and often it's not followed up on until after, well after the due date. And then what they often ask for is staff trainings, because the training all the stuff that we had sent when we sent it on time was not accurate when they got around to reviewing it. So that causes delays and stuff. So it'd be helpful if they could, look at it either in the point of time it was sent, or get to them more quickly so that it doesn't cause additional delay. We turn it around pretty quickly, additional information, but it seems like it just creates more hassle in the process.
So this is Janet again. This is a quality improvement strategy that is impacting involving providers and our staff. So we definitely will be looking at both sides of it because we recognize that we make errors or hold delays as well. So we'll be looking at both sides of that, Matt. And we'll be trying to, as I said, we will put that time frame in our operating procedures, but we will be trying to move things forward much more quickly than we have in the past.
Well, and yeah, and I mean, that was less of a criticism and more just, I guess a recommendation would be if they reviewed the application as of the date it was sent, for instance, then the information would be accurate rather than requesting additional information to bring it up to date with the date it's reviewed. So like there could be less back and forth essentially with the understanding that as of that date, and then everyone could just move forward.
And we will take that back. I appreciate that feedback. Thank you.
Thank you.
Yeah, and we have been looking at our processes. We refer to as process mapping. So provider services and this process we have been looking at. So great opportunities to further enhance. So we really appreciate the discussion here today, and I know Janet will take it back to the team. Okay, we're going to go to the next slide, and this is the update on ensuring the access rule. And we're going to turn it over to our Medicaid partner, Lisa Jones, to share some updates.
Good afternoon, everybody. This is Lisa Jones from the Office of Long-Term Services Supports, Medicaid's partner. Last month, I provided an overview of the 10 access rules mandated by the Centers for Medicare and Medicaid Services, or CMS, and I highlighted the HCBS Quality Data Measure Set rule and the grievance provision. Today, I'd like to highlight the Interested Parties Advisory Group provision and the Person-Centered Planning rule. The Interested Parties Advisory Group are people with direct home and community-based services experiences who help make sure that these services work well for people and assist the state agency, the OLTSS office, to examine reimbursement to ensure adequacy and transparency. This group will consider home and community-based services that include habilitation services, home health aid, and personal care services. This advisory group will advise and consult on provider rates where payments are made to the direct care workers for self-directed or agency-directed services. The group may assist the state agency with compliance with home and community-based services payment rate adequacy provision. The HCBS services payment adequacy provision requires that the state agency ensure that payment rates are adequate to ensure a sufficient direct care workforce to meet the needs of beneficiaries and provide access to services in the amount, duration, and scope specified in the beneficiary's person-centered plan. The advisory group is made up of direct care workers, consumer organization representatives, employer trade association representatives, participants or their authorized representatives, residential service agency representatives, worker organization representatives, and it will meet in a hybrid format, so they'll have access to participate online or in person. And the meetings are to be open to the public, with the exception of the very first meeting. The very first meeting will kind of lay the groundwork and get everybody acclimated to the advisory group. That first meeting is going to be determined. The date that's going to be held is going to be determined soon. And we're going to also note that on the website. If you want more information, there's a website link on this slide, and you can use that to follow along with the new Interested Parties Advisory Group.
Thank you, Lisa.
I'm sorry, ask her to pause.
Lisa, can you pause for a second? We have a few questions in the room.
Yeah, sure.
Okay, Rachel.
Hi, Rachel London with the DD Council. I have a couple questions about the interested parties. I know it was legislation. I remember it during this legislative session. I'm wondering how that will work with the DDA's rate review advisory group and this group that is also talking about services and supports. How will they work together? Are any members the same so that we can bring the information back to the other groups?
Yeah, that's a great question. So we're going through the applicants who applied to be part of the group. So once we made a decision on who's going to be part of it, we can determine if those participants cross the groups. We didn't exclude anyone. We are aware about DDA's rate setting group, and we're looking to possibly mimic that or combine efforts. So that's a great question, and we're looking into both of those options.
And this is something that I'll be working with Perry on because, as you know, with our rate review advisory group charter, the co-chair is supposed to be Medicaid's CFO. And so Perry and I will be talking about how we can integrate the groups and make certain that by way of the rate review advisory group charter, as well as this access rule, that the department is in compliance. That's a great question.
Beth.
Beth Benavides, I'm curious when people will be notified if they're part of that group or when those selections will be made.
A part of which group?
The Interested Parties Advisory Group.
Oh.
Elisa, Beth would like to know when individuals will be notified.
Very soon. I haven't heard an exact date, but we did get the applications in. They're being reviewed. We're vetting them, and then once we're able to establish the date of the first meeting, we will definitely let the participants know well in advance.
Thank you.
Yeah, sure.
Other questions or discussion? Okay, let's go to the next slide. And now I'm really happy to introduce Christina from our Quality Improvement Organization, Liberty Healthcare. And she's going to share some really great information related to our national core indicators as we talk about quality enhancement and improvement strategies. Can we go to the next slide?
Thank you, Rhonda, and thank you all for having us here today with you. So a few minutes ago, you heard the DDA team talk about how it checks how well services are working and that they share that information back with the federal government. And those are called performance measures. So this helps to make sure that funding continues for people to get the services that they need. And in the past, DDA has looked at how well providers and coordinators were doing and whether people were safe and healthy getting their services. This information comes from LTSS Maryland and directly from providers giving DDA this information. With the waiver amendment that's starting in October, we will also begin using what people directly say about their experiences with services for the performance measures. And this is going to be for the service plan and health and welfare performance measures. So Liberty does surveys like the National Core Indicator surveys with participants to learn how satisfied people are with their services. And the surveys ask questions such as, did you help to create your person-centered plan? Does your person-centered plan include things that are important to you? Do your staff come and leave when they're supposed to? And do you go to doctor appointments to stay healthy? So these questions going forward be monitored to let DDA know how things are going in Maryland. And if things aren't going well, we'll talk with people about ways we can improve. Next slide, please. So although this will be new for performance measures in DDA's waiver, DDA has been collecting this information for several years through the National Core Indicator Survey. So the next few slides are going to show you how people have responded to the survey questions over the past 2 years. So here we see that 8 out of 10 people said that they helped to make their service plan. And this is including just under 1,000 people in Maryland who participated in the survey over the last 2 years. Next slide, please. So this shows us that almost everyone, or 10 out of 10 people, shared that their person-centered plan included things that were important to them. Next slide, please. Over the past 2 survey years, 9 out of 10 people told us that their staff come and leave when they are supposed to. So we are excited to see that a lot of people are letting us know that staff are working when they're scheduled. However, it is important to know that when we ask this survey question, if that person does not have staff, then their response can't be recorded as part of this question. And so we know several factors like the COVID-19 pandemic or staffing shortages impact if people have staff, and we need to monitor how many people need but do not have staff. And also, person-centered planning should always check to see what supports can be provided in ways other than using paid support, paid staff. Next slide, please. We also learned that 6 out of 10 people go to doctor appointments to stay healthy. And we also call this preventative healthcare. So this includes primary care doctors, dentists, eye doctors, and other specialists that are recommended based on a person's age and sex. And we know that preventative health screenings can help keep people healthy longer, and that they can also help people to get treatment early when there's a problem. Coordinators of community services can be trained to know what health screenings are recommended for people based on age and sex. And with this training, they can talk to people about their screenings. So the goal would be that people are making informed decisions about what health screenings and when they go to their doctors. Next slide, please. So on the first 2 slides, if you remember, we saw that many people were happy. So that was 8 out of 10 people were happy that they helped to make their person-centered plan. And 10 out of 10 people indicated that their plan included things that were important to them. But some people said that their plan doesn't include everything that's important to them. So for example, in the past 2 survey years, what we saw was that only 4 out of 10 people who said they wanted a job had a goal in their plan related to that. And also only 4 out of 10 people who said they wanted to learn daily living skills had a goal for that in their plan. So this shows us that sometimes important goals don't get added to a person's plan. And since this came up a lot, we want to understand why. So there's a few questions that we can ask as to why this is happening. One is, are there any Maryland rules that are stopping certain goals from being added into plans? Are coordinators of community services talking to people about jobs, independence, and other important topics? And do people feel confident and know how to ask for what they want in their plan? So national studies tell us a few things also specifically about employment outcomes. So those who help to create their service plans have a higher rate of competitive integrated employment. And as we noted, in Maryland, currently 8 out of 10 people are helping to create their service plans. We also know that having a guardian is associated with higher rates of unemployment or underemployment. And when a person has a goal in their service plan for employment, they are 4.5 times more likely to achieve employment compared to those who do not have a goal in their plan. So there is a strong connection between people having employment goals in their plan and achieving employment. This suggests the importance of person-centered planning to identify a person's preferences and choices. And the path to better employment outcomes for people starts with planning for and actively supporting career aspirations. So by working together, we can make sure people's goals are included in their plans. We appreciate you listening to this important update, and we'd like to know if you have questions about the results of the survey, if there are other topics that you'd like more information about, or ideas for how we can use survey responses in the future.
Thank you so much. So as you're thinking about all that great information that Susan just shared with us, a couple things I heard her say. She talked a little bit about staffing and shortages and opportunities to look at alternatives. And so that made me think of assistive technology and some of the great opportunities for assistance there versus direct support. Christine, is there anything else that from a national level or that you have seen related to alternatives to some of the staffing?
There's not any information I have currently, but I'm happy to look into that and report back to the committee.
And then, Christine, you also shared about health screening and the importance of that and how maybe we can support our coordinators of community services with that. I think it may be another opportunity for us to look at maybe tools or information that we can support people who, with their health and reminding them of those opportunities in addition to families. So as we also look to enhance maybe some information in partnership with our coordinators of community services, maybe this is something the program team can look at that we can support through our practice of supporting families and supporting participants, because health is so important. And then I have one other thought. Go ahead.
Related to that, Rhonda, we are looking at an analysis of who is missing their health screenings. So when we look for that information and conduct the survey, so that we can tell you if there's certain demographics, age groups, living situations where people are missing their health information, so that we can make some more informed quality improvement strategies.
So let's pause there. Let's pause there to see, anybody have any thoughts about the direct support staff, those elements that you just shared with us? Or the technology?
I had a question.
Sure.
So this is Emily from the Waiver Advisory Council. So will the survey be written for people with learning disabilities to understand?
That's a great question. Christine, can you talk about the 3 different surveys and how they're administered?
Sure, absolutely. On behalf of Maryland, we conduct a survey with people who are receiving services and also 2 different surveys with families depending on the person's living situation. So when somebody lives in a home with their family, they get 1 family survey. When somebody lives outside of the family home, like maybe a residential community living group home or supported living situation, then they would receive a different family survey. And our surveyors are trained by the Human Services Research Institute, who is the organization who created the National Core Indicators Survey, to customize the survey for participants. We also, thanks to DDA, have been able to hire people like you who participate in services and receive services in Maryland. We call them peer surveyors, and they conduct the surveys with other reviewers and customize the questions to make sure that people are able to understand them.
Thank you. Rachel Linda with the DD Council again. Can I delve into who gets surveyed a little bit, just so I understand? You survey a certain number of people. Did you say around 1,000 or something?
Annually, it's generally between 400 to 500.
Okay, 500, I think. Are you surveying the people receive support and their family are the same 500?
So each survey, there's a minimum requirement of 400 per survey type. So that would be 1,200 total annually.
Christina, can you share a little bit more about HRSI and the National Core Indicators, kind of the rules and the standards of this survey? Because it's not a DDA survey. We don't come up with the sampling. Can you share a little bit about that so we all understand why 400, how does that work?
Absolutely.
And my actual question was about how the numbers broke out. So 8 out of 10, I'm just using the first one, 8 out of 10 people help make their person-centered plan. Is that 8 out of 10 of the just people with DD or just families, or is that a combo?
So the information that we looked at today is specifically from people who receive services in Maryland, not families. We do have that information separate, available online. So yes, Rhonda mentioned HRI, who is the Human Services Research Institute. So this is a national, they have created a national survey, the National Core Indicators Survey. Many states have participated in developing that survey and also participate in collecting information from people and families and providers through the survey process. The reason that we survey a minimum of 400 people in each survey type is because we want to be sure that of the people that we survey, we can say with a high rate of accuracy that the responses they provided us represent everyone in Maryland, or 95% of the people in Maryland. And what that means then is that when we see that 8 out of 10 people are helping to create their plan, or 4 out of 10 people would like a job but don't have a goal in their plan, that means that throughout Maryland, that is generally the standard for everyone.
Other questions?
This is Teresa with the Coordinating Center. What year was this?
The two surveys that we discussed today were from 2022 to 2023 and 2023 to 2024.
Thank you.
And then I would just add, in terms of employment, right? People who want employment, you shared some great information about employment goals, very important to us as an employment first state, that they're more likely to get competitive integrated employment. And so one of the things we have is we do have training, I think it's through the Supported Employment Leadership Network, that's specific employment training related to goals for our coordinators and community services. So we do have that additional support and training to support them about employment and the importance of that and goals. So that's something we'll continue to look at and support so that we can support individuals with competitive integrated employment. Yeah.
I'm not a survey question, but a follow-up to the employment stuff. Is that okay? Sure. I thought when was it 2016 with the Equal Employment Act, we revised that whole employment part of the person-centered plan to increase these numbers, basically. Is that still being used in the person-centered plan? So we would have data about why there might be, why it might not be easy for everyone.
Yep, exactly. So what Rachel's talking about, there was legislation was passed. We included those data elements into the person-centered plan, the employment focus area of the plan, which is a required area out of all our focus areas. It is mandated, required because of the legislation. So we can pull that. We do, our regional offices, as they're reviewing plans, if they see that Dr. Small says she's interested in finding a job, they'll ask, well, shouldn't she have, where's her goal, where's, supports for that. So we are looking at that, but that's a good point, Rachel. We could pull that data and look to see some of that information and crosswalk it.
This is Teresa with Coordinating Center. I think that's a good point because this is one point in time, and also recall is a factor in collecting of this data. And so whether or not they can recall whether or not they were actually asked these questions or actually included in their plan versus if it's actually in the plan. So I think there's a,
yeah, and
that's a consideration when you're looking at the data.
Just to speak to that, when we pull the random sample for this, we are pulling people who had their person-centered plan completed within the last 3 months, so that it is closer to when we're asking those survey questions and hopefully helps to mitigate some of that recall.
That's great. Thank you.
It is, Maryland's data is not inconsistent with the rest of the country. This data is national data. It's merged in Maryland is right along the same line, whether a state is considered an employment first state or not. So we are not performing higher as an employment first state than states that are not an employment first state.
One follow-up data question. Historically, so like pre-COVID, through COVID, now, is this number of people who wanted it, mine's cut off, who said they wanted a job and had a goal, Has that changed? Because there are factors in Maryland that make things different. I'm just curious.
So we have only collected this survey data since 2022 from participants. So we can only go back that far. And what we see is that for both years, the trend is the same. Maryland has collected the family survey data for longer than that. And we can go back and check to see if there are some trends in there that we could share with you.
Thank you.
Great discussion. Thank you so much. Thank you for the great information. Let me go to the next slide. And now we'd like to share some updates related to LTSS Maryland. And we have Megan here from DDA who's going to share some updates.
Hello, everybody. As Rhonda said, my name is Megan. I'm the LTSS DDA Programs Manager. So today I will be going through some system updates with everybody. Next slide. Maryland has 3 main information technology systems, which include MD Eligibility and Enrollment, also known as E&E. Oh, slide. Okay.
These are prior to that information. Megan, this is the updates that Megan provided.
Oh, okay. Sorry, everyone. The LTSS Maryland September 8th, 2025 release items that we just put out last week. The first one is the update in business logic for classifying pending applicants for the DDA community pathways, family supports, and community supports. We expanded access to the redetermination application client attachment category for the CCS, or coordinators of community services. Coming up in October, on October 6th, we have release items related to the waiver consolidation. We also have an update for a new service for individual directed family goods and services, which is the day-to-day administrator. That will be available in the PCP in October. And we are also renaming a client attachment category called FMCS documents to self-direction documents. Next slide. So on November 10th, we have a release for a new monthly fee for assistive technology services.
You're welcome.
And on December 15th, looking out farther ahead, we will have a standardized list of denial reasons for the DDA PCP, including policy reference when there is a denial.
So before we go to the system updates, any questions on those or discussion related to those updates?
Oh, sorry, I need to do it. Can you just explain or describe on the first page, the first slide, it says access to the redetermination application client attachment category?
Sure.
Thanks.
So in LTSS, we have an area that is called client attachments. That is where various users such as coordinators of community services, DDA providers, the eligibility determination can upload files to specific categories that are available to them. So at this time, the eligibility determination division are the only ones who can see the redetermination application category, which is not very helpful for our coordinators with assisting people during their redetermination process. So on September 8th, we gave the CCSs access to that category so that they could better assist their participants with their redetermination process.
Thank you.
Karen, did you have something?
Yes, so one of the requests I know that has been in for a significant amount of time is for providers to be able to see people's PCPs because there's no reliable way for the provider to receive the full PCP, even though we're responsible for implementing them. And we were told that that was something that was in the works with this, which would help certainly with compliance, and wondering if there's a schedule for that.
So at this time, we don't have a schedule for that, but that is definitely a discussion that we are looking forward to having with providers and other team members, hopefully in the very near future.
We've been refocusing priorities to accommodate for the consolidation.
That's a pretty big change, the consolidation. It's a pretty big change.
Yeah, we've been refocusing priorities.
Do we anticipate any issues around that?
Well, let's go to the next topic if you're good, because we're going to give you an update on it.
Okay, so now I will give the system updates related specifically to the waiver consolidation and things coming up in October. Next slide, please. So Maryland has 3 main information technology systems, which include MD eligibility and enrollment, which is also known as E&E. This is the system where a person's program enrollment is entered. The second system is the Medicaid Management Information System, also known as MMIS. This system is where Medicaid claims are processed and paid. The third system is LTSS Maryland. This is the state's data management system for home and community-based services. It includes information related to DDA applications, DDA's Medicaid waiver application packet, case management activities, and DDA's waiting list. The state has been working with these 3 systems to support the waiver amendment. The work that's being done with the update, or the work that is being done will update forms and special program codes for the family supports and community supports participants to be changed from community pathways. And this will update their forms and their enrollment codes. Each Medicaid waiver program has a special program code to let the system know which program a person is enrolled in. For the DDA operated Medicaid waiver programs, there are special program codes for the family supports, community supports, and community pathways program. Next slide, please. So on October 6th, all person-centered plans for people that are currently enrolled in community supports and family supports that had an active community supports and family supports person-centered plan will have that plan changed to a community pathways person-centered plan. All community supports and family supports person-centered plans that were being actively developed by the coordinator of community services will be converted to a community pathways person-centered plan. Next slide. So pending waiver applications, all individuals that have pending applications for community services or family support services will have their application converted to a community pathways application, and this will pick up where the last application left off. All individuals that are enrolled in community supports or family supports will have their special program code or their enrollment code ended on October 5th and converted to the Community Pathways Special Program Code on October 6th. Next slide, please. So, individuals who had their approved community supports or family supports person-centered plan converted to a community pathways person-centered plan may notice a short delay in LTSS Maryland identifying those community pathways person-centered plans as active. This is because there is a nightly job that runs to update the person-centered plans as active based on a combination of the person-centered plan effective date and the overall decision form status. Next slide. So the nightly job will take approximately from October 6th to October 8th to catch up and complete in order to tag all appropriate converted community pathways person-centered plans as active. We would like everyone to note that there is no action needed for the coordinators of community services or DDA providers that is needed. Providers can continue to bill, and they may notice that some of their activities are tagged with an exception due to a lack of an active person-centered plan, but those will automatically clear themselves once the nightly person-centered plan activation job catches up on October 8th.
So those are LTSS active.
Just to be clear, you're saying that those exceptions will automatically clear themselves?
Yes.
And this is all because the system has to catch up. So no effort by participants, families, providers, DDA, and the LTSS Maryland team, as well as the ED team. Everybody is working together to make certain that it gets cleared up without any effort from our partners.
And auto extend will also flip over
Every
as
plan that's in the system as active will carry on upon the consolidation. And we are going to be getting this information out. We're doing a comms that will go to all providers, including our case management providers, to reiterate, this is what's going to happen when the system goes live on October 6th, and you do not have to do anything. You're going to see that it doesn't indicate active on the 6th, but you'll see the catch up upon refresh on the 8th. Any exceptions associated with this effort alone will auto clear.
Rachel from the DD Council again. So this is outside my realm of knowledge, so I don't usually deal with providers, but we have heard a lot of the issues about LTSS going on. So I'm just, problems with payment. Is that a good way to put it? So I'm just being proactive and wondering at what point after the 8th should providers start to be nervous if those plans aren't auto populating?
So we are setting up a war room.
Okay.
My team members, as well as team members from the other entities around our partner agencies, will be in the room on October 6th and October 7th, tracking this very closely. Very closely. When we talk about system issues tied to payment, I just want to be very clear that often it is not a system issue. It is because the person's MA is offline. That's not a system issue. Not with LTSS Maryland.
Okay, thank you.
This is Teresa, Coordinating Center. So thank you. This is extremely informative. And I really appreciate the transparency around basically hold tight on October 6th until after the 8th. And so I know that'd be a big communication I will be taking back to my team. And I appreciate the transparency around the war room. I can appreciate any type of.
You can tell I work for Dennis Schrader.
Any type of, I just want to express that the understanding of any type of major system change like this is significant. And I can only imagine the discussions and the planning that's been going into this. so yeah, it's big. And so, and the fact that you just mentioned the war room, I think is fantastic because you're going to be right there to be able to identify any issues that are coming up. That I think it's a lot of reassurance that I can give at least to my team. So thank you.
Thank you.
And just to add for our preparation, there's ongoing testing right now in testing environments. So
that was my next question.
We are actively doing that and are checking the systems. And what Megan shared is just there's this delay because one system has to talk to another system.
Yep.
And it's like overnight. So some will come on the 6th, some on the 7th, but they'll all be done within the 2 days.
And if for some reason on the 8th, we're still there's an issue, likely happen, statistical use likely to happen.
Everybody's on standby.
Okay.
Everybody.
Is there a main number that we would call or how?
You would contact the regional
Regional
office,
office,
right?
okay.
It will have additional information the closer we get to October 6th.
Okay.
But we're going to put the good energy out in the
Yes,
universe.
absolutely, absolutely.
That, I mean, we're pulling off a Herculean effort.
Yes, you are. Yeah.
To Rhonda's point, we are meeting every day. I would say about 5 hours out of each and every day with every system partner. Every day, we're actively doing testing. We want this to be as seamless as possible. We cannot give an assurance that it will be 100% unglitched, but that's the goal. That is totally the goal.
And in talking with some of our partners about the systems, in terms of those challenges that may, but again, we have positive energy out there. It's been recommended to use the LTSS help desk process because then it can grab all that and analyze that. So
thanks for the correction.
Yeah.
Okay, so LTSS help desk process. Okay,
And we'll
got
be
it.
getting information.
Yeah, we'll
got
share
it.
more, but then that way it's,
Yeah.
it's in the ticket system, it's recorded. They can, they can
Let's get a report back even if they're all asking.
Yeah.
So,
Great question.
Great.
Other questions about consolidation, the LTSS updates?
I had a question.
Sure.
What does LGS stand for, and how does it help me?
Great question. Maybe you want to answer some of that?
LTSS stands for Long-Term Supports and Services. And that is just the name of the system because more than one Medicaid program uses that system. And DDA is just one of them. The system is definitely designed to, help everyone live their person-centered lives and get the services they need and do the things they want to do in the community that they want to live in.
And it's ultimately the department's electronic health record that has all of your service and support information in one central location. So the person-centered plan that you have, that you work with your case manager, that is in LTSS Maryland. And it sits there. So your case manager actually engages with that system to make certain that your holistic person-centered plan is available to the department.
Thank you.
Great question. Okay, just checking on that. All right, well, why don't we go to the next slide? And Charlotte, we're going to turn it over to you.
Thank you, Rhonda. I've been appreciating everybody's comments and the discussion over the topics that we've been listening to. As update goes for the lived experience group, we are still meeting and we have appreciated and look forward to the efforts that DDA has made with regards to this council load to make information more accessible and to adapt or change the manners of, giving that information to the members that are in the lived experience group. I did kind of want to bring up something separately that I was thinking about when we were discussing some of the data points earlier and about the, I think it was 4 out of 10 people had goals and other person-centered plan. I think it's important to recognize what sort of policies or changes could affect participants' abilities to even know that. Hello?
We can still hear you, Charlotte.
Okay, I'm sorry. There were certain proposed changes that I believe personally could affect things like that. And so I think just putting an attention or a notice to what changes or policies we write that could affect people in their ability to feel like they could even have a goal or a job. Because for me, as an example, today did, everything right. I had backups, I had emergency people, and I still could not fully commit to I could not fully uphold to my commitment today. And it's kind of a real experience that a lot of us have when constantly scheduling or dealing with care. And so I think kind of understanding how those two intersect would be important moving forward.
Yeah, Charlotte, I think that's a really great point. Really appreciate you sharing that. And we do appreciate you joining us. You have fulfilled your commitment and you are here with us and really sharing, I think, some really important things for us to keep in mind.
Thank you.
Comments, questions, discussions? Or are people with lived experience?
Jessica.
Okay, we'll go to the next slide. Oh, I'm sorry, you gotta go back one. We have our waiver recommendation work group. If there's any updates.
I think I was nominated again to present.
Rachel.
Yes. I have just a little update. I think it was last week, we met and had really good conversation and started thinking ahead. I know everyone is sort of in the waiver amendments right now, but thinking ahead and really focusing on that service delivery and access to services piece, and had a really robust conversation about people who have co-occurring conditions, so also need behavioral health support or mental health support, but also other things. So if there were additional disabilities, not just IDD, that people needed, and some of the struggles that people have in accessing those services. And so really wanted to kind of more of a question, I think, know if that's something, I wrote down some other things from today that we could talk about, make recommendations about, but if that's the kind of thing are we there? Can we start thinking ahead, or do we need to keep thinking about kind of where we are currently? So we're in a holding pattern now, but I don't know if anyone listened to the national conversation that the DD Coalition hosted with Next Gen Synergy last night. Obviously, the Deputy Secretary did, she was one of our presenters. But I think all of that discussion we had at the subcommittee and then last night, all very, very timely. So something we are really interested in digging into if we get the green light, I would say, is sort of our update.
Well, I know, really appreciate that, and I believe Karen and Charlotte have shared that email with that recommendation. A couple things, I know we have a lot more to talk and discuss about the amendment, just to keep that on the forefront. I'd also like to share, we did get a lot of great public comments that we didn't move forward on because we want to have further discussion. So I think that would be something that we would want to respect the input that we received from individuals. I think that personally, Rhonda, I think that that's a very important topic that you're talking about, people with co-occurring. And we do have a money follows the person effort in terms of co-occurring conditions in a work group and a recommendation. So I know that there's been some work done with that maybe that's something that could be, continue to explore related to that. But I do want to respect the public comments that we had gotten before and would love to meet with the group to kind of share that and work through those items in terms of what we're trying to do right now.
Great.
Next Monday, free.
I mean, to Rhonda's point, we have, with this waiver amendment, it was really, really good feedback that we received. We couldn't incorporate into the one amendment that was submitted on July 17th. We are looking forward to additional opportunities to engage the council and the subcommittee on the additional things that were discussed. Co-occurring is very important as well. You heard me speak to that importance. The team and I are actively working on some co-occurring work. And so once we finalize some things on the co-occurring side, we can certainly bring that topic to the Waiver Advisory Council and the subcommittee and talk about how we can integrate it into future discussions and ultimately a future amendment or upon renewal, because we're coming up on the renewal as well. We have a lot of work underway with the consolidation, with the amendments. Pretty soon we will be preparing for what is called the evidence-based report to CMS to demonstrate that we are operating the waiver in the manner in which we told CMS we would be operating, and that's all evidence-based. So lots underway at one time, but definitely a topic that is important and that we can integrate in future conversations.
Anything else, Rachel?
That was the big part. No, I will make sure, we will make sure, sorry, I was just talking, that for the subcommittee, that the comments, which I know are on your website, but we'll just make sure everybody has that link and we can start there with our next meeting.
Good, that's great.
Yeah.
And I'm happy to join, probably not Monday, if we could get through the amendment process. I'm happy to start those other discussions.
We can get through the comments.
Yeah.
That make it, yeah, I knew
Yeah.
they were going.
Absolutely. And there's some other things that we'd like to talk about, the reporting tool for legally responsible people, legal guardians, and substitute judgment. So those are things that, as per the amendment, that would begin in April. And so we've got some initial thoughts, working with a few stakeholders already that's reached out and we've partnered with, which has been fantastic, but would like to get additional input on those items so that we can continue to operationalize the existing amendment and then look at those different future opportunities.
Great, thank you.
All right, so now we're gonna go to the next slide, and now we're going to open it up to public comment. Before I do, just want to again ask one more time for the council if there was any additional discussions or things that we talked about today that you'd like to revisit before we open it up.
And also, before you open up, can you just recap our understanding and next steps for us before we open it up to public comment?
So for us, again, appreciate all the discussion today. So we talked about a number of things today. For our qualified providers, we're going to be taking that feedback back and making sure that we're looking at the entire process, which we have through process mapping to make sure that we are also being timely and responsive of that. We talked a little bit about our national core indicators and also possibly looking at some of the data there related to our focus area exploration and people's plans to see how that looks, and also look at some of the impacts potentially that COVID or other data elements that may be for our paper surveys or surveys that went to family members compared to some of the situation today. Charlotte really helped to keep us grounded as so important that we need to make sure that all actions and policies and decisions we're making, that we consider how that's going to impact people with disabilities. It's important. We had a great discussion about different opportunities and training for coordinators of community services. Teresa and Caitlin have shared some of the strategies and things that they do. And so there's always opportunities, I think, for all stakeholders in our system to look at conflict resolution and strategies as we deal with or talk with and partner with individuals and families, and we want to support that. Let's see. We will, some of our next steps, Megan also shared with us some of the information about LTSS updates, and the communication will be going out to all of our providers and coordinators of community services to let them know that great information that we shared today. There will be a 2-day delay with the plans becoming active. They will be there. People will be enrolled. So in Medicaid, if you check the Medicaid system through the electronic verification system, they will show enrolled. Just that plan active status will be delayed up to 2 days. And we will share communication that you can contact the LTSS help desk if after that there's a problem. We are excited. I don't know about you, but I've been really getting pumped up and excited about this time. Maybe that's just because we've been very busy. Really looking forward to it. And on the 10th, we're going to be coming together as a team, all the different systems, so that we can watch and monitor that and take immediate action based on anything that would unexpectedly occur. But there's a lot of great work going on related to that. Anything additional that anybody else wanted to add that maybe I missed in the summaries of our next steps? And then we will be meeting with the waiver recommendation group to talk about some of the additional operationalizing of the current amendment, and then looking forward to talking about those additional stakeholder input strategies that could be further explored. Okay, so for we're going to open up for the public comment period, and we have some questions that we received online, so we're going to do a little bit of both. And similar to what we've done, I think in the webinars this week, we'd like that if you're going to ask a question, just ask one question so that we can make sure that everybody has an opportunity, and then we will come back to people. So if you'd like to raise your hand, and we will also look at the questions in the chat. So I'm going to go to some of the first questions. We had a question about the internet services. So today we talked about CMS has let us know and directed us that we cannot continue to cover monthly service fees, but we will be able to do that initial part of the internet. So the question is related to that. Just noting that on Monday, or Tuesday, when we shared the webinar, that we had shared that goods and services that households that do not have a disability would pay for, examples like monthly internet services and subscriptions to televisions. The person is commenting thinking that those are contradictive. The statement or the information that they're referring to is actually under a list of things that will not be covered. So it's not part of the allowable item. So if it does fall in line with, we're not able to continue to provide under the federal program the monthly services for internet services. Okay, why don't we, and if you'd like to raise your hand, we're happy to open your mic too. So go to another person. We had another question. This was related to Karen's comment about, or question about training for coordinators of community services. And the question was, will there be any training provided to financial management and counseling services providers? So I think that's absolutely something that we would want to do, as we were talking about that conflict resolution. As I said, it really should be something for all of us, all stakeholders that support individuals and families. So I'm happy to continue to explore that. And if any council members or others have some information about some really great training that we could look at, that might be something that we could push out available to all of us to use that. But the financial management counseling services providers would absolutely be receiving those training too. Let's open Paulette. Paulette, I know that you've had some questions in the chat and you raised your hand, so if you'd like to share one of your questions, that would be great. Okay, Paulette, we're going to come right back to you. We're going to start with Laura. So Laura, your mic has been.
Hello. You mentioned there's a new monthly fee for assistive technology. I was just hoping you could elaborate on that a little bit.
Sure, oh, absolutely. Thank you so much. So with the amendment, we have shared that under assistive technology, and it's a current practice that monthly service fees associated with assistive technology is covered. In working with the Center for Medicare and Medicaid Services, they've asked us to pull that out and separate that. They want to see 2 separate lines for that. So what we have done is we have noted it specifically, called it out as a service under assistive technology. In addition, as Megan shared today, it will be an option in our person-centered plan as one of the drop downs. So it'll be assistive technology - monthly service fee. So that will be specifically noted on the person-centered plan. Providers would be approved for that, and then they'll be able to bill through the provider portal process specifically for that monthly service fee. So it's just a new specific call out under assistive technology. Thank you for sharing that question. We're going to go to Paulette in 1 second. Okay, Paulette, we will come to you, I promise. We're working on that. We're going to go to Mary Jancic. Mary, so if you'd like to share one of your questions, I know we've been looking at some of your questions in the box too. So if you'd like to share one of your questions.
Yes, thank you. So the first question that you had answered was the one that I had posted about the IFDGS, and it specifically stated that equipment was excluded from the IFDGS for internet and everything else. It says goods, services, equipment, and supplies that a household, but yet you're now saying that the equipment for the initial setup would be something that IFDGS could cover.
Yeah, thank you, Mary. I'm happy to go back and look at that again. So I'm sorry if maybe I'm not communicating well, but I do understand what you're saying based on the language that we had put in there. So I'm happy to go back and take a look at that. Thank you for pointing out and sharing that with us.
Sure, thank you.
For some reason, I can't unmute Paulette just yet, so.
Paulette, we are working on unmuting you. I'm going to look, because I think you've had some questions in the box. So Paulette, one of Paulette's questions was, what if a participant has problems with the quality of service provided by the coordinator of community services, meaning the actual coordinator or the agency? So I think that's a great question. I think in general, individuals that may have concerns with any type of provider or anybody involved in the service delivery system should absolutely follow up with that. Depending on the situation, you can contact the agency or the supervisor to share those concerns. All agencies have a complaint remediation process. If it's something that you feel falls within an incident in our policy for reportable incidents and investigation, absolutely reach out to the DDA. We're happy to support that. The Office of Healthcare Quality also has the opportunity for people to reach out to them to report concerns also. So those are always opportunities for that. So any concerns with quality of services, please reach out, and we're happy to further support those efforts.
Over here for Laura Lear.
Laura, Lear, if you'd like to share your question.
I asked my question earlier. I'm sorry. I forgot to put my hand down.
Yeah, thank you. Okay, I'm just going through some of the others to see if there's other people that asked to give other people's voices here. So we have a question or comment from a person who knows to be a sole practitioner and has shared that some concerns or challenges with communication and tracking systems for them to be compliant with the programs. Just noting that under private insurance and licensure, there are clear portals and a reminder sent out well as clear information for renewal. And many providers choose to let it lapse because they don't know how to make their profiles active if they no longer want to provide the services. So thank you so much for sharing that. And I think we heard today that Janet was sharing that we're going to be looking at our providers licensed and certified, in addition to sole practitioners, to support communication and also renewal of information or processes related to Medicaid enrollment and continuing enrollment. So thank you so much for sharing that. Paulette also shared a question. Are there considerations regarding problems with the MyMD thing, getting information into the system for the redetermination? So thank you for sharing that, Paulette. We are continuing to support and work with our Medicaid partners related to the various systems. We do have the update that we shared related to the redetermination client attachments. We look forward to continue to support that process and partnering with our coordinators of community services with additional training that the eligibility determination division will be joining us. So we'll continue to support that, and I know that they are also looking at their systems. No? Okay. She knows she's getting the request, however, she's still muted somehow.
She has to unmute.
We had a question if there's a point of contact for the LTSS change on October 6th. That's coming from one of our coordinators of community services. So we are happy to further talk to you related to that. Just a reminder, on October 3rd, we will be conducting a webinar on the LTSS updates, where Megan is going to be sharing some great information similar to what you did today, but also walking through screenshots and things going on related to LTSS Maryland. We're happy to team up with our coordinators of community services and do additional presentations related to that.
That's in the list of already the series of webinars coming out. That's in the list.
On October 3rd,
yeah.
yes.
Yeah.
We had a question about the council, and so we're also excited that as of October 1st, our council members will be expanding as per legislation. And so we will be reaching out to some new individuals that will be joining us for our October meeting, so more to come on that. So we're really excited about that. There was a question related to the council. We had a comment about our NCI surveys, and just noting that it may not be a clear indication of the climate of the state. Surveying 400 individuals for our waiver programs. And so a couple things related to surveys and information. We utilize a lot of different strategies to gauge the system and see how we're doing. And I know Christina shared some of those today. So as a quality improvement organization, which means it's a organization that the federal government has recognized and certified to meet high quality standards in terms of evaluating systems. Liberty Healthcare does a lot of reviews. They look at our targeted case management services in terms of activities, developments of the plans, looks at providers. We also have a variety of other things. So I'm going to stop talking and let Christina share some of the different quality measures we use that help to also give us information about how the system is working and performing. And maybe we can talk a little bit about the personal outcome measures too.
Sure, absolutely. Be happy to do that. As part of our contract with the DDA, they are pursuing network accreditation through the Council on Quality and Leadership. And the Council on Quality and Leadership is a nationally, actually internationally recognized organization that promotes best practices for people in this field. And so we do conduct the personal outcome measure interviews as well, or conversations with people that look at the supports and outcomes that people have present in their life, and whether or not those supports are impacting positive outcomes. We are very excited that we've collected 2 years worth of data so far as part of the network accreditation process, and are working with the Council on Quality and Leadership now to summarize that data for you. So we hope to have that for a future presentation as well. But as Rhonda mentioned, there are multiple types of different reviews that Liberty conducts, and we look forward to bringing you information from each of those reviews in the future as it relates to performance measures and quality standards.
Great, thank you. We also have a comment about the access rule in terms of sharing the person-centered. Elisa, are you still on? Is there some additional information you could share? We had some discussion about the interested party advisory group, and the person is interested in maybe some additional information about slide 29 related to person-centered service plan. Elisa may have to drop. Okay. Well, I know we are at 3 o'clock, and so I just want to again say how appreciative we are for you joining us today and sharing the information. It was a great, rich discussion, and we look forward to next month's meeting. Reminder, we are meeting monthly now, and so be on the lookout for emails related to agendas, the minutes from today's meeting, meeting location and more. So thank you very much and have a great day.
Thank you.